Okay, so first thing I'm going to do is to review the chart, patient's chart, check whether there's order for an ABG, and then I'm going to check what kind of patient what kind of medication the patient is on, whether she's on blood thinners or not, whether there's been a change in ventilator settings. So 10 minutes is the usual. If it's air trapping disease, it's 25 minutes. If that's all good, and then I will go and get the equipment. Basically, I'll need an ABG kit, and then I'll get 2 patient labels. So once I got my stuff, I'm going to the patient's room, going to knock on the door, introduce myself as a respiratory therapy student, verify his information, ask him for his first and last name and his date of birth. Once I'm done, I'm going to wash my hands, I'm going to put on some gloves, and I'll go to the patient's bedside. So once I'm at the patient's bedside, I am going to choose the hand that I'm going to perform the arterial puncture on. I'm going to choose a non-dominant hand. If that's injured because of the chart, what I've seen in the chart, then I'm going to go to the other hand. So once I've selected the hand, I'm going to do the Allen's test. Basically, what I'm going to do is I'm going to cover both the radial and ulnar artery. I'm going to ask the patient to please squeeze and open your hands, squeeze and open your hand. If the patient can't do it, I'll help him. Open and close, the patient's hand should be white. And then I'm going to hold on to the radial, release the ulnar, and then the palm and the hands should be pink again within a matter of seconds. And then that is the validity, or to show that there's collateral flow. So once that's done, I get my ABG syringe, draw it back to 0.8 milliliters, and then I'll get my gauze right here, got my alcohol prep, clean the site, and clean the gloves, and I'm going to palpate. Once I've identified the artery, I'm going to draw that. And then, okay, Mr. Mannequin, you're going to feel a slight pinch at your arm in 3, 2, 1, and then I puncture at an angle of 45 to 60 degrees. So I'll adjust if I need to, and then there should be a flash of blood, and then it will start filling. So once the syringe is fully filled, I'm going to pull it out, get my gauze, I'm going to press on it. Okay, and then I get someone to hold it. So holding on to the artery for at least 5 minutes uninterruptedly. So what I'm going to do is I'm going to safely cap my syringe, remove the needle, and put on the cap. I'll get rid of the bubble, and then I'm going to rock and roll. Once that's done, I'm going to get a patient label the syringe, put it in the Ziploc baggie. So once I'm done, I'm going to check to see, after 5 minutes, to see if the patient is still bleeding. If the patient is not bleeding, everything is okay, just give it a little wipe, put on the band-aid, and ask the patient how is he doing. If everything's okay, I'll thank the patient and I'll leave the room with the sample. So I'll go to the ABG machine, go ahead and run it, and get ready to chart. So the results of the ABG should auto flow to the flow chart, the patient's chart. What I'll have to write down is whether the Allen's test was a positive or negative, on which hand did I perform the arterial puncture on, how many times did I perform the puncture, and then I have to chart the ventilator settings. So during the time of the arterial puncture, what was the settings? So that includes the mode, the frequency, the set rate, the peak inspiratory pressure, the PEEP, the FiO2. And then yeah, that's all for the charting.